Hello, we're Group Lima, and our topic is case control versus cohort studies.
At first glance, it may seem trivial or even challenging to differentiate between these two types of studies. In the simplest of explanations, these studies differ in the way that they select participants. For example, outcome versus exposure. Both of these studies have strengths and limitations, which will be discussed. Timing is key in differentiating between the two, if the participants are selected based on the disease outcome or based on a certain exposure. In this presentation, we will cover the important differences between case control and cohort studies, as well as discuss the pros and cons of each. In addition, we will provide some real-world examples to help apply these concepts. I've already stressed that these two types of studies are different from each other, but do they have anything in common? They actually do. Case control and cohort studies are classified as observational studies. This means that the researcher observes individuals and measures variables of interest, but does not attempt to manipulate or influence the variables. In observational studies, it is important to note that one cannot determine causation, only correlation.
Cohort studies are divided into either retrospective or prospective studies. In a retrospective cohort study, researchers look at data that already exists. The participants are selected based on exposure to risk factor, and we're looking for differences in disease outcome. We are trying to identify risk factors for particular conditions. A limitation is that researchers cannot go back in time to gather missing data. In a prospective cohort study, we are also selecting based on exposure to risk factor and looking for differences in disease outcome. However, researchers develop a question and follow a group of people over time, and we are also trying to identify risk factors. One limitation is the length of time you have to follow the group of people. This diagram reiterates the difference between a retrospective and prospective cohort study. In a retrospective cohort study, the composition of the cohort and assessment of exposure was done in the past. However, in a prospective cohort study, the composition of the cohort and assessment of the exposure is done in the present. In a retrospective study, the assessment of the outcome is done in the present, whereas in a prospective study, the assessment of the outcome is done looking into the future.
Here is a real-world example of a cohort study.
Some advantages of cohort studies include allowing examination of multiple effects of a single exposure, avoiding selection bias at enrollment, and cohort studies also more clearly indicate the temporal sequence between exposure and outcome. Some disadvantages of cohort studies include the length of time that you need to follow the subjects. They are not good for diseases with a long latency, and it may be difficult to identify an appropriate exposed cohort and an appropriate comparison group.
Case control studies. What are case control studies? The researcher is comparing two groups, the group that already has the disease or outcome, which are the cases, and the group that does not have the disease or outcome, which are the controls. It is a retrospective study. No intervention is required from the researcher. The researcher looks back to see how the risk factor affects each group. Case control is selected based on the outcome. This is an image that shows a study design where the investigator identifies and selects patients who have the endpoint or outcome of interest cases, and also patients without the endpoint or outcome of interest controls, and looks back in time to identify exposures or characteristics that are linked to the cases. Here is a real-world example of a case control study. The control group were matched to cases on age, sex, height, and season. The case group were recruited from the fracture clinic at the hospital for sick children.
There are some advantages to case control studies. For example, it can be done quickly and you already have most of the data. It's also cost efficient and also could be more ethical because you aren't putting a person at risk of getting the disease. The person either has the disease or does not have the disease. There are some disadvantages to case control studies. First, there's recall bias. It may be difficult for someone to remember something that happened some time ago, so relying on the memories of the people who participated in the study isn't the most accurate way to recall risk factors. Second, they're subject to selection bias. You cannot randomize your sample size because you know which people have the disease or do not have the disease. You also cannot explain causation. A statistical relationship does not necessarily mean one condition caused the other. Causation does not necessarily equal correlation. Quiz yourself. Do you know the difference between case control studies and cohort studies after this presentation? Well, take a minute, look at the questions, and answer them. The answers will be coming soon.